Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. I'll begin today by updating you on the latest case numbers and outbreaks from the weekend. And then I would like to address a few questions that I've heard around cohorts. Provincially, the number of people in hospital or ICU with COVID-19 remains stable, with 51 people in the hospital, including 9 in intensive care. This is a slight increase from Friday, but well within our health system's capacity. It is good news that our hospitalization numbers have been generally declining or stable since peaking at 93 hospitalizations on July 22nd. Our public health and provincial lab teams continued working hard to identify new cases and process tests through the weekend. On Friday, September 18th, we identified 119 new cases, while the lab completed more than 12,400 tests. For Saturday, we identified 102 new cases and conducted about 9,700 new tests. And yesterday, we confirmed 137 new cases and completed more than 12,700 tests. Finally, I am happy to say that more than 15,000 Albertans have now recovered from the virus. We continue to closely monitor schools, and when new cases are identified, our health and education officials are working quickly to limit any possibility of spread. In 5 schools, alerts have ended, and all students and staff who were self-isolating at home have gone back to class with no in-school transmission resulting from the potential exposure. There are currently 81 schools with active alerts or outbreaks where 1 or more individuals have attended while infectious. So far, a total of 126 cases are linked to those schools. This includes 6 new school outbreaks that have been identified, bringing the total to 19 in the province. Alberta Health Services is working closely with these schools to investigate close contacts. I want to remind you that we define an outbreak as 2 or more confirmed cases in individuals who have been present at the school in the last 14 days. That is a very low number to reach and is not an indication of uncontrolled spread. I recognize that there is anxiety that comes with students returning to the classroom, and I am being as transparent as possible when I share information about cases. That is why I want to let you know that we have also identified another 2 schools where in-school transmission has likely occurred. This transmission was identified in cases at Vimy Ridge School in Edmonton and Springfield Elementary School in Peace River. As I stressed on Friday, this is not unexpected and is not a cause for alarm. As we have seen transmission in other settings, we will see some cases where this happens in classrooms. We are working with schools and Alberta Health Services to keep these numbers as small as possible and prevent broad spread within a school. Anyone potentially exposed has been or will be contacted and asked to self-isolate. Finally, I want to speak about the fact that we now have 2 schools on watch status. This is simply an indication that an outbreak has 5 or more cases. The Vimy Ridge School has crossed this level with 6 cases and will therefore be shown on the map as in watch. The only thing this reflects is the number of cases, not ongoing risk. While I know that the safety of schools is of utmost importance to all of us, it is important to remember that only 3% of all schools in the province have had any COVID-19 exposure to date. And of all those schools that have had 1 or more exposures, transmission has only been identified in about 3% of those. So overall, only just over 1 school in 1,000 has had a transmission episode in the last 3 weeks. We will continue to monitor closely, as always, but this is a positive start. While our school numbers remain encouraging, sadly I must report that 1 additional death occurred over the weekend. This death was in a patient at the Foothills Medical Centre in Calgary, and I would like to extend my condolences to this individual's family and loved ones. We take any outbreak in an acute care facility very seriously. To date, 14 patients and 4 staff members on 3 units have now tested positive for COVID-19. The public health investigation is still underway, but Alberta Health Services has taken swift action to ensure that all staff and patients who may have been exposed are isolated and getting tested. I've been assured that all necessary outbreak protocols have been implemented. With widespread testing underway, it is likely that we will identify some additional cases in the coming days. I know that any outbreak is concerning, especially in a care facility, but any patient with symptoms or who has tested positive for COVID-19 is isolated and treated in designated rooms. The Foothills Medical Centre remains a safe place to visit and to receive care. There is no increased risk to patients coming to the hospital. There has also been an outbreak identified at the men's residence of St. Joseph's College at the University of Alberta. There are currently 5 cases linked to this outbreak. AHS and the university's public health response team are working together to support contact tracing and to care for the health and isolation needs of those impacted. Before ending today, I would also like to talk a bit about cohorts, as I know many Albertans have had questions. A common question I've been asked is, what exactly is a cohort? A COVID-19 cohort, also referred to as a bubble, circle, or safe squad, is a small group whose members can regularly interact without staying 2 meters apart. Your core cohort is your family or household group and up to 15 other people with whom you have chosen to spend time where rules about distancing can be relaxed. This should be the same 15 people at all times who are all committed to this cohort, and even in the cohort, anyone who is sick should not have close interactions with others. Smaller core cohorts are less risky than larger ones. All other cohorts will vary depending on what you are doing. So the people you interact with in a sports league, in a childcare setting, or at a school would be cohorts. Co-workers or attendees of the same church are not considered cohorts and should maintain distance and public health precautions in their interactions. Another common question I have had is how many sports cohorts a child should be in. That is a difficult question. We recognize that staying active is important for our mental health and physical well-being. At the same time, it's important to recognize that the more activities a person participates in where distancing cannot be maintained, the greater their risk of exposure. Many different factors can also impact the safety and risk of exposure that is faced by participating in a sport or activity. For example, it is easier in some sports to maintain 2 meters of distance between players, and a cohort model may not be needed if distancing can be maintained at all times. With other sports where players are inevitably in close contact with one another, risk of transmission if someone is infectious while playing is greater. This means the cohort model is an important way to keep that risk contained. Each family and team must determine what level of risk is right for them and what level of risk they deem to be acceptable. While this conversation is challenging, it is part of what being on a team is all about. Part of playing a team sport is working together for what is best for the team, and discussion about cohorts is another element to that. I encourage families to limit the number of cohorts that their members are part of, including sports cohorts, but I also can't set a single number that will be right for every family or every team. Teams or sports organizations may choose to limit their players to just one cohort, or they may set a minimum number of cohorts that their members can belong to. This is based on risk tolerance and conversations with players, coaches, and parents where applicable. When in doubt, I recommend keeping sports cohorts as limited as possible during the coming fall and winter, as it is possible we will see a rise in transmission of COVID-19 as the weather gets colder and activities move indoors. Finally, I have been asked whether we will lift the current restriction limiting sports cohorts to 50 participants. We continue to monitor this closely, However, at this time, there is no plan to raise the cohort number in the immediate future. Alberta Health is closely monitoring all the factors above to determine whether and when an increase in cohort size would be appropriate. We will continue to closely monitor the spread of the virus in Alberta. If changes are needed in the future, we will make them. As I have said countless times, we are all in this together. And it is only together that we can find the right balance between limiting the harms of COVID and the harms of restrictions. Thank you, and I am happy to take any questions you may have.
All right, we'll go to the phone now. The Deputy Minister of Alberta Education could not join us today, so if media have questions that require that focus, I'd encourage them to follow up with Alberta Education for more info. Operator, could you put through the first caller, please?
First is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. Thanks for taking my question. In small communities, whose responsibility is it to make sure large gatherings that exceed the provincial limit don't happen? And is the province considering scaling back the amount of people allowed at large public gatherings, similar to what Ontario did this weekend?
So in small communities, as would be the case with larger communities, there are a variety of people who can be involved if there are gatherings that exceed the limit. The first group of people I would say have that responsibility are the organizers of an event themselves. And organizers and participants of an event, again, as Albertans, we all have a responsibility to each other to limit the risk of COVID-19 spreading. And so those individuals would have a responsibility to understand what the limits are and to follow that guidance. And if they're not doing that, then there are different groups who can come in to assist with reminders about that. So law enforcement can remind people about that guidance. Environmental Public Health at Alberta Health Services can be involved in that. And there is a complaints line or a complaints website where people who have concerns can go online to Alberta Health Services Environmental Public Health to submit a concern or a complaint. It is challenging in a real-time situation, so I would encourage anyone who's aware of an upcoming event where perhaps a large gathering is planned, where efforts to remind those individuals of the guidance are not successful, to try to give AHS a little bit of advance time so that they are able to reach out to the organizers and remind them of the reasons why limiting the numbers of people in a gathering is important. With respect to decreasing the number of people in a gathering, we continue to watch our numbers and our transmission patterns very closely. I recognize that Ontario has decreased their gathering limits. At this time, we are not doing that in Alberta. What we are doing is watching again to see where we see patterns of transmission and really encouraging Albertans, as every single one of us has a responsibility to our community, to make it possible for us to continue with this balance of being as open as possible with all the activities that support our health, while at the same time protecting each other from the spread of COVID-19. And we will continue with that approach while watching our data. If our data indicate that we need to consider any other restrictions, we will at that time have that discussion.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. The number of active cases in Edmonton makes up almost half of all active cases in the province, and the majority of new cases from Friday, at least, were in Edmonton. You've mentioned in the past that your team is keeping a close eye on the city. What are the early conclusions about what's happening in Edmonton, and with the city still being on the watch list, are extra measures being considered?
We are watching Edmonton closely, and at the moment, about half of all active cases in Edmonton are somebody who is a known close contact of a confirmed case. So we're looking into that pattern to determine if there are other things that we can do to prevent onward transmission when we identify a case. I've spoken before about the tremendous amount of work, and again want to really highlight my gratitude to the work of those in the lab, those in the assessment centres taking samples, and public health doing contact tracing and follow-up, because all of those people with the work that they do, when we can do that as quickly as possible, that does give us enhanced opportunity to prevent onward spread from the person who is a COVID case to others. So those are all the pieces that we're looking at for those close contacts. About a third of the cases in Edmonton, the active cases at the moment, are of an unknown source. So again, that can change over time as public health completes their investigations. But we're also looking in to see if there's any trends in those individuals, to see if there are any particular activities that seem to be driving the majority of the cases. At this time, as I've said before, many of the transmission events do seem to be linked to more social events. We have seen a number of workplace outbreaks in the last several days that have been coming up. And again, that I think perhaps misconception that people who are in a workplace together are a cohort. So wanting to remind people that even in a workplace, that there should be distancing, masking, symptom screening happening to make sure that we're minimizing transmission in those settings. And finally, if we do identify any patterns where we could potentially alter our guidance or update transmission risk, then we would look at that. But to date, we have not seen one single pattern that would be amenable to additional restrictions.
Operator, could you put through the next caller, please?
Next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. I want to know how worrisome it is to have such an outbreak at the Foothills Hospital in Calgary, since it's a very busy hospital.
Certainly any acute care outbreak is a concern, and this particular outbreak seems to have unfortunately happened with some in-hospital transmission between patients. And of course that is always a concern when that happens. What is good about this particular outbreak, now that these cases have been identified, is that measures can be put in place to limit the possibility of any onward transmission. And I've also asked the Alberta Health Services team to look very closely at the factors surrounding how introductions into the hospital may have happened, so that we can learn from that. We have learned lessons from the Misericordia outbreak, and anything that we can learn to improve going forward is really critical. So, of course, this is concerning, and at the same time, knowing about it gives us the chance to make sure that it doesn't spread further, and we can continue to improve our prevention efforts.
Operator, could you put through the next caller, please?
Next is Sean Burnett with CTV Calgary. Go ahead, Sean.
Dr. Hinshaw, picking up on that, looking at the measures that can be taken to prevent, the spread of COVID-19, especially in hospitals, are you finding that our patients, visitors, not adhering to mask-wearing rules, even staff, is that slipping in some of these cases? What have you learned so far, and what have you learned particularly about the outbreak at the Foothills Hospital, about how this may have come into the hospital, to those two outbreaks?
Sure. So there are a few things that have been reported, but I will say that the investigation is still underway, so I don't believe that there's a final determination yet. There have been some reports of inconsistent masking use in visitors that are being investigated, as well as concerns about a staff member who may have worked while symptomatic. And as I've said before, I think it's really important that we understand what the barriers are to people being able to follow the guidance with respect to not working while symptomatic, to wearing a mask, particularly when in an acute care or long-term care setting. Because the more we understand what got in the way in those instances, the better able we'll be to prevent that from happening again. So those are some of the issues that have been reported. Again, those are still under investigation, so we're still trying to determine exactly how the introduction happened. And of course, when those lessons learned are finalized, we'll be able to apply them to our other acute care settings.
Operator, could you put through the next question, please?
The next question is Thomasina De Silva with Global TV. Go ahead, Thomasina.
Dr. Hinshaw, the numbers on school outbreaks or school cases sound really promising. But what do you have? I have been hearing from a lot of parents who are concerned that the test results are taking too long to come back, and that their students aren't, their kids aren't able to go back to class in a timely manner.
Sure. I think there's two parts to that. So the first is when a student has mild symptoms. So let's say a student who isn't part of an outbreak, they're not a close contact of someone with COVID-19, but they just have some mild symptoms. We want those kids to be able to get tested and get results as quickly as possible, so as soon as their symptoms resolve and they're feeling better, if they test negative, that they can go back to school. And that's work in progress across the system to try to reduce the turnaround times for our lab testing. And there is a lot of work going into that to make that happen. It is unfortunately a very complex system, so it's not something that can change overnight, but we recognize that getting test results as quickly as possible and getting tested as quickly as possible, both of those are really important, and there is a lot of work going into making that happen. The second piece is if a child is identified as a close contact, whether at school or out of school, often they will be asked to have a test taken, have a swab done. Independent of the results of that test, though, they do still need to stay home for 14 days. And I think that has been something we've heard concerns about from parents who are worried about the fact that even though their child tested negative, why do they have to stay home for 14 days? And the answer to that is if a child is a close contact of someone with COVID-19, they themselves could get COVID, and it could take up to 14 days for them to get sick. And if they test negative at any point in that 14 days, it doesn't guarantee that they will remain negative for the entire 2 weeks. So while it is a very long time, unfortunately, in those cases, they do need to stay home for that full 2-week period. What we are doing, however, right now we're taking a very cautious approach. So when there is a single infectious case in a classroom, that entire class is asked to stay home for that 14-day period. And we're watching very closely our experiences with those class cohorts to understand how we can be more targeted so we don't have to have the whole class stay home in future once we have our own data to be able to understand how to pinpoint those close contacts who are most at risk. We will be able to focus just on those and not have the entire class stay home. But for right now, and I do know this has an impact on parents, we are having that whole class stay home for that full 14-day period and working on being able to target that going forward when we have enough data.
Operator, could you put through the next caller, please?
Next is Don Braid with the Calgary Herald. Go ahead, Don.
Dr. Hinshaw, did you say there were 19 school outbreaks now? That is 2 to 4?
So there are 17 school outbreaks 2 to 4 and 2 school outbreaks with 5 or more. In both of those cases, that's 2 schools with 6 cases each.
Yes, and you also, okay, thanks.
All right, Don, I think you might have had a follow-up there. If you need to reach out to me after, we'll certainly find whatever information you need. Operator, could you put through the next caller, please?
Next is Gil Tucker with Global TV. Go ahead, Gil.
Oh, sorry for the delay there. Question about the Foothills outbreak. How concerning is it that one of the outbreaks was in the cardiac unit where the people have extreme conditions, of course, and deteriorated health?
Absolutely, this is a concern. We know that heart disease is a risk factor for severe outcomes from COVID, and so it is, of course, very concerning that this is a group of patients who now, some of whom have had exposure to COVID-19. So again, this is a situation that will be monitored extremely closely. Patients will be tested regularly, even if they have no symptoms, to determine if they have become infected, and any further possibility of transmission will be stopped, while very close care and attention will be given to those who unfortunately have become infected with COVID-19.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Next is Sarah Ryan with Global News. Go ahead, Sarah.
Hi, Dr. Hinshaw. So we just heard from Edmonton Public School that they had to send 48 staff home over the last 3 days to isolate 545 students, yet you're saying this is a positive start to the school year. What do you say to all those families that are impacted? Because some of them are talking about, wanting to pull their kids out of the schools entirely, especially at somewhere like Vimy, where it's now considered a watch.
I recognize that having an entire class isolated has a significant impact on parents and families, and I can understand that there's frustration in the perhaps lack of ability to plan, because of course when an exposure happens, we do need to intervene quite quickly for the class or those who might be at risk to be able to be told that they do need to stay at home for that next 2-week period. And so I understand that's very disruptive for families. And of course, the numbers of staff and students who are isolating at this time, each one of those numbers represents inconvenience for those individuals. And my conclusion that the first 3 weeks of school have had a positive overall trajectory is not to minimize the impact that each individual exposure has had. What I think is important to remember is that the vast majority of the cases that have been infectious while in school acquired their disease at some point in the community. And we've looked at the numbers of school-aged cases that we've seen in the community since April. And what we've seen is the number of school-aged cases that we've identified every week really fluctuates with our overall community transmission. So while absolutely there is a significant impact on parents and teachers and families when there is an infectious case in a school, what we're not seeing right now, and of course we're monitoring in case that changes, but we're not seeing a significant onward spread in the school. And as I said earlier, once we're able to get additional data and target the close contacts who are most at risk, there will be fewer students at some point in the future. I would say, within the next few weeks, we should have enough data to understand how to target those close contacts. So there will be fewer families impacted by those exclusions. But again, right now, we're taking a cautious approach because we don't want to see schools become a source of transmission. So while I know it's frustrating, I would ask families to remain patient. There may be some families that the right decision for them is to consider other options, but I would ask families to remain patient, to stick with us for the next few weeks so that we can target our approaches based on our own data.
Operator, could you put through the next caller, please?
Next is Matt Woodman with CTV. Go ahead, Matt.
Hi, Dr. Hinshaw. I'm just curious, prior to school restarting, did you and your team put together like some case number projections for school reopening similar to the ones the province presented when the economy relaunched? And what were your case number expectations for schools, and how many is too many? At what point do you have to say, you know what, it's just time to return to online learning?
The question about projections, of course, we don't have a crystal ball, so we don't have the ability to predict with any kind of certainty how many cases we will see in schools. As I have said before, we did anticipate there would be some transmission and some exposures in school. And that question about how many is too many, I think one of the interesting things as we've looked at our own data on the weekly numbers of school-aged cases is we saw our maximum number of school-aged cases in mid-April when we saw the peak in the province. So on the week of April 22nd, we had 216 cases in children between the ages of 5 and 19. And we haven't reached that maximum yet. So even with school reopening, we've actually seen the numbers not go that high. So for example, the week from September 9th to 15th, we had 183 school-aged cases and only 122 school-aged cases between the 16th and the 20th of September. So again, what's important isn't the total number of school-aged kids who get COVID. That's a reflection of community transmission and fluctuates as our community transmission changes. What's really critical for schools is that schools don't become a place where transmission happens and spread happens quite broadly. Our kids are best served by education in person, and that has an overall benefit to their health much bigger than just that benefit of maintaining protection from COVID-19. So as long as we're able to keep schools as a place where transmission is not happening broadly, the benefit to kids for their social development, their learning, their educational development, and really all of the things that support our children's health overall is best served by keeping our schools open, and that, of course, is our goal, which is why we're focusing on minimizing transmission in schools. With respect to what everyone can do to make that successful, because the correlation between community spread and cases in school-aged children is so close, every single Albertan can make school reopening successful by working to limit and minimize community transmission. And again, that's a message I want to make sure everyone understands, that the issue of successful school relaunch is not just about schools, it's about all of us.
Operator, can you put through the final question, please?
Final question is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hello, thank you. In BC, the Ministry of Health removed 10 symptoms, including sore throat, runny nose, from student health checklists when going back to school. Are we looking at changing the symptoms in your screening test for kids as well here?
We've had some discussions about mild symptoms when we've been talking about this with my colleagues across the country, because we know, especially moving into the fall, that some of those very mild symptoms, like runny nose, can be very common in children. I think in Alberta, we're not far enough along yet to know whether or not we could take some of those symptoms off of our lists without increasing the risk that COVID-19 could be introduced into the school. And again, this has been something that has been discussed at length as we try to reach that right balance between keeping our kids in school and making sure that their learning is as smooth as possible, while at the same time minimizing the risk of a COVID-19 introduction and spread. So right now, we are keeping our list as is. Of course, we will look very closely to see what BC's experience is and experiences of other provinces and territories who may be considering similar things. And if we feel that we can make that change without putting our schools at risk, then we will consider it. But at this time, we are sticking with our long list of symptoms.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon. Have a good day.